positivity rate, 9.64%, the highest it's been in months. We also have 622 people hospitalized. And if you haven't yet been vaccinated, you are at very high risk for contracting this virus right now. It's very important, if you're not yet fully vaccinated, avoid social interactions, wear a mask around others. If you are, you can certainly breathe easier. More and more Coloradans are getting vaccinated every day. And in our communities with higher vaccination rates, the number of COVID cases are dropping and are lower than areas of our state with lower vaccination rates. We're seeing a real tangible impact on the impact of, and what Dr. Herlihy will walk you through is Colorado's 10 largest counties. It's hard to use small counties in these studies because you need statistically significant numbers. So she looked at the 10 largest counties. And we're really looking at how the level of vaccination impacts the level of virus. We did it last week by age. We're doing it this week by geography. But this is just for anybody out there who's just still, waiting to see how these vaccines work and work in Colorado. They work. That's why people in their 70s and 80s, our number in our hospitals is getting lower and lower. It's unfortunately why the number of people in their 20s, 30s, and 40s is going up, because many of them haven't been vaccinated yet. It's also why areas of our state have more danger from the virus, more hospitalizations, more cases, and other areas have less. So I'll turn it over to Dr. Herlihy to update you on this correlation between vaccinations and cases, and really how we can act to protect our own communities that we live in.
Good afternoon, Governor. So as the governor mentioned, we are unfortunately continuing to see an increase in cases. The increase that we've seen in the last week or so is slower than the increase that we saw several weeks ago. But we did see a little bit of a stabilization last week. I reported on that last week, but unfortunately it looks like the numbers have ticked up again. So this is being seen not just in our case data, which is shown in this figure, the red line showing you our 7-day moving average trend, but also in our hospitalization data. As the governor mentioned, we saw a big increase in hospitalizations yesterday and then an increase again today. So unfortunately, those numbers are heading in the wrong direction once again. Next slide. But as we know, the trends are pretty different across the state, both by age group and by geography. The governor mentioned that I'm going to show you some data looking at differences across the state based on vaccination rates. But part of the story that I wanted to share with you today, too, is some of the differences that we are seeing among children right now compared to adults. And previously, I've showed you some of the data around different trends in different age groups that have been vaccinated or not. But this figure specifically is looking at a comparison of children in different age groups compared to all other Coloradans. And so what's shown in this figure is the age group of 18-plus-year-olds, so anyone who's an adult in Colorado, shown in dark blue, compared to two different age groups for children. So we have an age group of 11 to 17-year-olds representing middle school and high school children, and then an age group of 3 to 10-year-olds representing preschool and elementary school children. And so what you see here is that we're really seeing our most rapid increase right now in the state among middle school and high school students. Their rate is much higher than what we're seeing on average for adults in the stage, and that the increase we're seeing is pretty steep at this point. We're also seeing an increase in those younger children, those in that 3 to 10-year-old age groups. It's not as dramatic of an increase, not as steep, but certainly seeing an increase in those age groups as well. Going along with this data, we're also seeing an increase in school-associated outbreaks across the state. For the last several weeks, we have seen that increasing trend as well. Next slide. Another significant difference that we're seeing across the state right now is trends county by county. And so this is the analysis that the governor was talking about. We're really seeing differences in case rates in counties that have high vaccination rates compared to counties that have lower vaccination rates. And so this is a correlation analysis where on the left-sided vertical axis, you see our case rates per 100,000. So the highest case rates would be in the upper left-hand corner. And then along the horizontal axis or x-axis, you see our vaccination rates. So our highest vaccination rates would be in the lower right-hand corner. And you see this diagonal line that we've drawn that is showing you really that correlation, that association between high case rates and low vaccination rates, and then high vaccination rates and low infection rates. So you'll see that we see some counties that are clustered in that upper left-hand corner. Those are the counties that have higher rates right now, but also have these lower vaccination rates. And then in the bottom right-hand corner, you see our counties in the state that have high vaccination rates who are also now experiencing lower case rates. There's a number of counties grouped in the middle here that have both mid-level case rates and mid-level vaccination rates. So overall, what we're really seeing here is our first clear sign, our first promising indication that we're seeing community level protection from vaccination. So we're seeing our communities protected through levels of vaccination that are higher. We're seeing that impact really on case rates occurring, again, from county to county. So not at a level of herd immunity, I would say yet, but certainly seeing signs that we're heading in that direction where we're starting to see these associations. So overall, what we calculated here is that for every 10% increase in vaccination rates, we see a correlated decrease in cases of 51 per 7-day case rate, so cumulative case rate per 100,000. Thank you.
So just keeping this slide up, you can just see the difference. So, Boulder and Jeffco nearing 65% vaccination rate, you can just see the decreased circulation of the virus in those communities. And then Pueblo and El Paso have significantly lower vaccination rates. That's why I was in El Paso and Pueblo last week trying to drum up interest in getting vaccinated. There's no place in the state that it's easier to get vaccinated than Pueblo, Colorado. Pueblo State Fairgrounds takes walk-ins. FEMA's running the site. In El Paso County, we have the Broadmoor World Arena site. And of course, as Dr. Herlihy mentioned, while the rates are lower in Jeffco and Boulder and Denver because of vaccinations, it is not yet herd immunity, right? We need to be somewhere closer to that 70 to 80% range. You're closing in on 65. When you get up to 75, 80, there's just not enough hosts to effectively spread the virus, meaning the R naught will be below 1, the cases will go down, and whereas they're stable in some of these areas with high vaccinations and going up in areas with low vaccinations, we need to get to that level where the virus simply no longer has enough hosts to spread effectively. And I also want to announce with this information about kids, the Pfizer vaccine is available for 16 and 17-year-olds, and I want to be clear. And Colorado's Children's Hospital is going to be a partner now in working with 16 and 17-year-olds, and then we also are very hopeful, the paperwork's already been submitted for 12 to 15-year-olds before the school year starts next fall. So we're hopeful that that'll be approved in the next month or two so that there's time for 12 to 15-year-olds to get their 2 doses before school starts. But right now, 16 and 17-year-olds can get the Pfizer vaccine. Colorado Children's Hospital is offering it at Aurora and Colorado Springs. So Aurora, 13123 East 16th Avenue, Colorado Springs, 4090 Briargate. You can register at childrenscolorado.org/getvaccinated. And there's time slots for kids, 16 and 17-year-olds at this point. Again, eventually it'll be 12 to 15. If you as their parent haven't gotten it yet, you should be able to get it with them. They're generally available Monday through Friday. Again, you're in and out 20 to 30 minutes. And so we're hopeful that adding Children's Colorado to the rapidly expanding list of providers helps give some parents reassurance to have more comfort with their 16 and 17-year-olds getting vaccinated if that's their caregiver, and making it quick and easy to be done. Last week, I announced that 4 of our Vaccines for All community vaccination sites offered same-day walk-in vaccination service. Today, without reservations, today I'm announcing that all 6 of our Colorado community vaccination sites, let me start that again. Today I'm announcing that all 6 of our Colorado community vaccination sites now accept walk-ins without appointments. You can simply show up and get vaccinated at the Ranch Events Complex in Larimer, the Colorado State Fairgrounds in Pueblo, Ball Arena in Denver, Grand Junction Convention Center, and in Mesa County. So at all 6 of these sites in Dick's Sporting Goods in Adams County, you can now show up and get vaccinated. Now it's still always better if you're organized. By all means, set up an appointment. You can do that. There's thousands of slots available over the next few days. Go ahead and set one up. But if you don't set one up or just don't feel like using the internet, or you're just driving by and you're like, I have 15 minutes, don't worry about not having an appointment. You can get vaccinated. You'll be done in 20 minutes. People who are planning to get vaccinated, Denver's Ball Arena, which is Pepsi, formerly known as Pepsi Center, for those who don't follow the names of things. There's 4,000 appointments available at Ball Arena today and tomorrow, and you can set one up or you can just go and get vaccinated. And I really, really encourage you to do that. It's open till 7 p.m., so you can do it after work today. Specifically, Ball Arena / Pepsi Center is open Monday through Friday, 7 a.m. to 7 p.m., and Saturday, 9 a.m. to 4 p.m. So, thousands of appointments available in the next few days. Adams County Dick's Sporting Goods is open Sunday through Thursday, 9 a.m. to 5 p.m. Centura.org/COVID-19 to set up appointments. El Paso County Broadmoor World Arena, Friday to Tuesday, 10 a.m. to 6 p.m. Centura.org/COVID-19, or you can show up. The Ranch Events Complex, Loveland, Monday through Saturday, 10 a.m. to 6 p.m. You can set up an appointment or just show up. Grand Junction Convention Center, Wednesday through Saturday, 9 a.m. to 7 p.m. You can set up an appointment or just show up. And of course, the Colorado State Fairgrounds, where you absolutely just show up and get one. It's super easy if you live in San Luis Valley, Pueblo, Southern Colorado Springs. Really easy to go to the Colorado State Fairgrounds, and encourage you to enjoy some of what Pueblo has to offer while you're there if you're visiting. These walk-in or drive-in, as the case may be, drive-in without an appointment experience is really a game changer in the race to vaccinate Coloradans, because there are many Coloradans who don't feel like they want to load up a web page or sign up somewhere, but are happy to take 15 or 20 minutes out of their day to get vaccinated. And that's who we're calling upon to get vaccinated. Nearly a third of Coloradans are fully vaccinated, and we're over half of Coloradans, 2.5 million, 2,505,053 that have gotten their first dose. Rising cases among our unvaccinated are just a reminder right now that this virus waits for no one. Start your protection clock, get vaccinated. More and more colleges across our state and country are making sure that students get vaccinated before returning to school, giving parents and students the confidence that they need to be able to return to the classroom. And if you've been putting off getting vaccine until there's more availability, or for those students looking to return to campus in the fall, now's the chance to get vaccinated. If you don't live near one of the sites I just mentioned, or you want to go somewhere else, you can call our hotline, 877-CO-VAX-CO, 877-268-2926. They can help you identify pharmacies near you, grocery stores, other places you can do it if you don't feel like going to one of the drive-through sites. cocovidvaccine.org. If you can't drive, you can't take a bus, you don't know how to get somewhere, dial 211 or visit 211colorado.org. Free rides to vaccination sites across Colorado. I want to thank Mile High United Way's Ride United program for that. So, you don't drive, you can't get out on your own, just call 211. They'll be happy to schedule a van or car to pick you up, take you to get vaccinated, take you back. Easy. I've also heard from Coloradans that some people are hesitating to get their first or second vaccine because they're worried about missing work. I want to make sure I remind people that when I signed the Healthy Families and Workplaces Act last year, all regular employees working full-time or part-time were eligible to receive paid time off January 1st for health and safety needs. That means that you have the right to take 4 hours of paid time or sick leave for a vaccine appointment, even when scheduled during work hours, or use paid time off while recovering from a COVID vaccine. And employers are required to honor that right. We want everybody to get the vaccine as soon as possible. Many employers, as a best practice, give people the day off to get it. We've done a number of clinics at large employers, and they've made sure that people are on the clock while they're getting it. But you have the right to take 4 hours of paid time off or sick leave to get the vaccine. And if your employer is not doing that and making it hard for you to get vaccinated, please call Colorado Department of Labor's Division of Labor Standards at 303-318-8441. where you can lodge a complaint or ask questions. We take this very seriously. Most, of course, employers are not only doing the right thing, they're encouraging folks to get vaccinated, but if there are some out there that are not, you can absolutely report them and your privacy will be protected. As we surpass the 4 million dose mark, and we are at 4,070,842 doses in Colorado, we know that the end of this pandemic is in sight. And those who are at the highest risk have been protected. It's now a matter of ending the pandemic and getting back to the Colorado that we love. And look, we're a little competitive in Colorado. And I think that chart that Dr. Herlihy he showed that. If your community has some of the higher COVID rates and more hospitalizations and deaths because the vaccination rate is lower, let's take that up in that community to get that vaccination rate higher. All 3 vaccines are safe and highly effective. All 3 will pave the way to ending this pandemic, to saving lives, to getting back to normal. We're doing our best as a state to make it easy for you. And we all want to win back what has been taken by this virus, a normal life, a thriving economy, and we are rapidly achieving that. So let's finish strong, Colorado. If you haven't been vaccinated, please continue wearing your mask, especially in those communities where the COVID cases are still on the rise because they haven't achieved a level of vaccination to control them. Keep a distance of 6 feet from others when possible if you haven't been vaccinated. And of course, if you haven't been vaccinated, most importantly, get the vaccine and empower others and encourage others who haven't been vaccinated to do the same. If you have 2 or 3 friends, if your family hasn't been vaccinated, you all drive down to one of these sites, you all get vaccinated, you're in and out in 15 minutes. That's how we end this. That's how we get back to normal. That's how we save lives. And that's how we protect the communities that we love in our great state. With that, happy to take some questions. Yes.
Is the state considering going to any 24-hour vaccine sites? I think they've done that in some other states where it'd be open all day long for anybody who has any.
Well, I mean, if there's interest, if there's people that want to get vaccinated at 3 or 4 in the morning and can't do it another time, we certainly would be open to that. The key thing is that they're open beyond normal work hours. So many of them till 6 or 7 p.m. And on weekend days, some are Saturday, some are Sunday. Absolutely, if there is demand and if people want to get vaccinated at 1 or 2 or 3 in the morning, we absolutely would be happy to do that. I would expect that's more likely to start with working with employers that have graveyard shifts and making it available at those sites in an employment-based model. But if there's demand outside of that for other hours, we'd be happy to find a way to accommodate that.
It's David Clue with Denver 7. I have a question a bit off topic and a follow-up, if you will. Once again, it appears the state legislature has failed to move forward on a public option health care bill that actually has a public option in it. Do you support the new version of this legislation, and do you believe private interests have once again weakened this effort?
Well, my core goal and core value is to save you money on health care. It's one of the reasons I ran for governor. It's one of the reasons I signed into law the reinsurance program that reduced individual rates by an average of 20%. This new version of the bill, is my understanding, will reduce healthcare costs by about 18% over the next 3 years. That's a pretty darn good deal for Coloradans. Coloradans are sick and tired of spending too much on premiums, too much out of pocket. This bill won't fix everything in the world, but it goes a long way to saving people money on healthcare.
And do you support the bill that's currently being debated now? And
Yep.
do you think private interests have succeeded once again?
I'm proud to support a bill that will save Colorado consumers 18% on health care, on premiums, on out-of-pocket. That is an enormous step forward. Not every single bill is going to be every single thing that everybody wants, but saving people 18% on their health care costs is a huge deal, and I'm enthusiastically supportive of it.
Hi, Governor. This is Joe Vaccarelli from Denver 7. How do you account for this kind of slowdown we're seeing in the number of vaccines being administered in Colorado? Are you seeing it as a sense of hesitancy on people who haven't yet gotten it, or still a need or anything like that?
Yeah, we're not at so we're not at a it's not a resistance to vaccine issue. It is what you might call a hesitancy or laziness issue. It's people and we know this from research, they will get the vaccine, but it's not immediate in their minds. They're thinking I'll get it in the future, maybe in a month, maybe in 2 months, maybe it's some indefinite date. Well, that time is now. Step up and get it. So it's a matter of convenience, of ease. There's people who still think they have to spend an hour reloading web pages and it's hard to set up appointments. Guess what? It isn't. Easy to set up an appointment, and you don't even need an appointment. You can just show up and get it. So it's sort of breaking through there. there. The third reason is that, of course, Johnson & Johnson, the single-dose vaccine, which is preferred by many people because it is only one dose, hasn't been available for 2 weeks. It only recently became available again, and we have over 70,000 of those available for Coloradans.
Thank you.
Hey, Governor, this is Gabrielle from Fox 31. I have two quick questions for you. The first being, just wanted to check on community efforts. How have efforts like the vaccine buses impacted the vaccine lag that we're seeing in rural areas of the state?
Yeah, so we announced our Western Colorado itinerary for vaccine bus, Fruta, Grand Junction, Palisade. We have both buses deployed. There are areas of our state where we want to make sure it's convenient to get the vaccine. You shouldn't have to drive an hour to get to a hospital or a pharmacy. We want to be in your community, in your neighborhood, with ease of simply showing up and getting it. So absolutely, that convenience and that ease is a big factor in both urban and rural communities of making the vaccine more available.
Are we seeing people sort of turn up for those buses? Like, what's the turnout been like?
Yes, they are taking appointments and also walk-ins at those bus locations, and we are reporting that out in terms of their utilization. They are able to do about 500 a day. They certainly don't do 500 every day. It depends on where they are. Sometimes it's 200 or 300, but there is a lot of demand for that convenience that the mobile buses provide for.
And then just looking at the number of young people that we're seeing in the state test positive for COVID, is it time to re-examine how schools are quarantining and handling in-person class as the school year kind of wanes down a little bit?
Well, it's one of the reasons that we're emphasizing the partnership with Children's today and the drive for 16 and 17-year-olds to get vaccinated. Not all 16 and 17-year-olds are aware that they're eligible for the Pfizer vaccine and can get it. They can get it at a drive-through site. They can get it at a pharmacy. Now they can get it at Children's Hospital as well. We also believe it's very hopeful and important that the next cohort, the 12 to 15-year-olds, will hopefully be approved by the FDA in time for them to be protected before students return to school in the fall. We just have a few more weeks of school this year. School districts will finish out the year with the types of precautions they've been taking to avoid major outbreaks, and the mask wearing, and of course the testing that has been available to teachers and to students, including at the site level.
Hello, Governor. Jesús Carrasquel from Noticias Univisión Colorado. Gobernador, en base a la reciente información de los CDC y el uso de las máscaras, ¿qué considera necesitamos para que se elimine el uso de tapabocas por completo en el estado?
Los habitantes de Colorado no vacunados todavía corren un gran riesgo de contraer este virus mortal y sin la vacuna deben seguir tomando precauciones, incluido usando las máscaras, el distanciamiento social y evitar las grandes reuniones. Mientras más personas se vacunen, más cerca de lo normal podemos estar, especialmente para las personas que no ya recibieron el vacuno. Es muy importante todavía tener precauciones y ser seguro.
Hi, Governor Seth from the Gazette. Following up on the vaccine rate question, how confident are you that, increasing convenience at the 6 community sites will address that and turn the trend around? And if that doesn't do enough, what's the state's plan to improve uptake as we try and get to herd immunity?
Well, our data and research shows that you do have the vast majority of Coloradans, upwards of 80%, are willing to get the vaccine, are interested in getting the vaccine. It's only a small percent that's actually resistant to it. But for many of them, it is a matter of hesitancy or laziness to get it. The people that really wanted it have gotten it. Now it's making sure that the people who, in some abstract way, think they'll someday get it, instead concretely make a plan to get it this week or next week. And that's going to be the challenge of the next few weeks.
This is for both of you. So based on the chart that you were showing earlier about the communities that had high vaccination levels and the lower COVID there, would you expect that if that continued, we'd have a longer tail to the end of the pandemic? And things just kind of...
Well, I think what it shows is the pandemic will end at different times in different communities. To be clear, it hasn't ended anywhere yet, but by these numbers, some communities will reach herd immunity levels before other communities. And so in the communities that have reached that herd immunity level, 75, 80%, there will no longer be community transmission of the virus. If there are still communities at that point that are at 55 or 60%, there will still be enough hosts where that virus will continue to spread at a community level.
Well, follow-up. So what are you basing that sort of laziness presumption on? And it seems counterintuitive that our vax rates would be going down when we've improved to general eligibility. So, it seems particularly concerning that we're, not at least holding level.
With the demand for vaccines, are you referring to?
Yeah.
So keep in mind that we're at, I think 54% of eligible Coloradans have gotten their first vaccine. We might need to, it's close to that. We'll get you the exact number, but about 54% have gotten their first vaccine. We also know that there is vaccine resistance. That might be 10, 12, 15% of the population. So what we have left is the 30, 35% of the population that isn't resistant. They do say they're going to get it, and yet they haven't gotten it. And so you ask yourself why, and generally it's a matter of planning. It's a matter of many people thinking it's hard to get, or you need to sit at your computer for an hour and a half to get an appointment and search 20 sites, or it's not convenient, or they don't know how to get it, or they can't get a ride to get it. So those are the barriers that we're trying to breach. You can't get a ride, call 211. You don't want to mess with setting up an appointment, show up without one at one of these sites and get it. You're in a rural area, the bus is coming through, right? So it's how we deal with these sort of barriers that prevent us from getting to everybody who says that they want to get the vaccine.
Hey, this is Megan for Post.
You're breaking up?
Okay, I think they gave you, can you hear me now?
Yes, please go ahead.
Okay, all right, so got the equity partnerships, the mobile units. What else is being done for people who just aren't really seeking out or aren't really looking at information? How do you reach those people?
We've had over 200 equity clinics in church parking lots with community organizations. We have the 2 buses that are running a very busy schedule across the state. We have the free rides with Mile High United Way. And of course the drive-through sites where you don't need an appointment ahead of time. So it's really all hands on deck for a comprehensive approach to make sure that no matter where you live, no matter your background, your income level, this is available to you in a convenient and accessible way. And part of that's on us to make that available, and then that's on you to take advantage of that opportunity to protect yourself, protect your life, protect your family, protect your community, take advantage of that opportunity that we're working hard to present to you.
After the pandemic, we've been going back and forth for schools having in-person and then virtual learning. With this new spike in cases among school-age children, how committed are you to keeping schools open moving forward, even as the cases spike?
Oh, schools are again a relatively safe place. I think what's happening, some of them, a small number might be related to schools, but what's also happening is as parents are protected, as grandparents are protected, they're taking their unprotected 11-year-olds and 15-year-olds, out with them to restaurants, to hang out with others. And while their elders may be protected, the young people don't have that level of protection. So, again, there's some of all of that in this. We are very confident that, the school year will finish out successfully, that next fall will be a successful return to in-person education. We're particularly hopeful that the FDA will approve the vaccine for 12 to 15-year-olds in time to protect 12 to 15-year-olds before they return to school next fall.
So even with this new spike in cases within school-age children, you're confident that most of the spread is happening outside of the actual school?
Yeah, kids have been back in school in many districts all year long. In other districts, they've been back since January. This is a more recent phenomena. While there's no question that there's some transmission that might occur in a school environment and probably has, it's also likely that a good part of this is community spread and is simply a result of vaccinated parents returning to a lifestyle of more socialization and openness, but of course bringing their unvaccinated children with them. So, we'll never be able to know exactly the extent of each. But we do know that, that again, with the precautions that schools take, with the mask wearing, with the quarantine requirements, they are a relatively safe place to be, as they have been throughout this pandemic. Many school districts across our state have been in person the entire school year. Others have been in person the last 4 months very successfully.
I think I heard you say the positivity rate was above 9%?
Today, yeah.
And hospitalization above 600. Do you have a sense of what's driving that? How concerned
Yeah.
are you at those high numbers?
Well, I'm concerned. Today, Tuesday, we often have the lowest testing numbers of the week. So if you look at every Tuesday, we often have the highest positivity rate. I think what we really need to watch is the next few days. We only have 13,000 tests reported. So we, once we're back up at 30, 40,000, what we need to see is then, is there a lot more cases, or are those negative? So we'll be there in the next few days. It should serve as a reminder to everybody, if you're sick, get tested, right? If you're under the weather, if you think you've been exposed, it's incredibly easy to get tested. You can even do it at home with a home test, and we encourage people to do that. Yes, the hospitalization numbers continue to increase. It's especially people in their 20s, 30s, and 40s who haven't been vaccinated. Hospitalization numbers, 70s and 80s, are continuing to decrease. Hello? Sean?
Hi, yes, this is Sean with CBS4. Governor, just asking about the CDC guidance that has come out about people who are vaccinated, and now that they can participate in more activities maskless and be around other people. Is that guidance you support and want to see in Colorado? And also, do you think we need more incentives and reminders to people about the benefits of being vaccinated, like not wearing a mask, to get those numbers up?
Yeah, and the CDC, as is their job as a science-driven organization, has been very cautious. In Colorado, we've never had an outdoor mask-wearing requirement during this entire pandemic. A few communities have done that. Those have largely ended a few weeks ago. So in many ways, we're ahead of the CDC on that. The best advice that I can give is that if you haven't been vaccinated, wear a mask when you're around other people. And keep a distance with other people. If you have been vaccinated, you absolutely can return to, gatherings of vaccinated people in your home. In fact, even the current mask requirements don't apply to groups of vaccinated people in Colorado. So if there's 10 or more people that aren't vaccinated, wear a mask. But if it's a dozen people and it's, 3 families and they're all vaccinated, there is no mask wearing requirement in our state. And yeah, that absolutely is yet another reason to get vaccinated. I think the biggest reason is to protect your life, to avoid getting this deadly virus. But absolutely, you don't have to worry about wearing a mask and avoiding social gatherings once you are fully vaccinated. 2 weeks after the second dose of Pfizer or Moderna, 2 weeks after the first and only dose of Johnson & Johnson.
I have a quick follow-up. Can you just also share what you know about where the J&J vaccine is now being used, specifically with those mobile sites, now that that pause has ended? Yeah,
we'll have to follow up. I know the current the ones in Fruitigrad, those are going to be Pfizer. So it just depends on the site and the day. We can follow up with you for people that might want, if they want to select J&J, where it might be available. Everything is disclosed, so when people set it up, they'll know, is it Moderna or is it Pfizer? Is it Johnson & Johnson? And you can't pick at the site, but you can pick by where you go to where you get it, because each site is usually just doing one that day. But you can if you have a preference. But again, they're all highly effective. They all work. But I understand some people want one instead of two, and we'll follow up with you with sites that are doing J&J over the next week.
Governor, Chris Vanderveen with 9 News. Can you hear me?
Yes, go ahead.
Governor, I have a question in relation to the really pretty notable increase in patient count. Just over the last month, we've seen almost a doubling in patient count in the state of Colorado. Are we doing any more analysis as to what might be causing this, i.e., are we looking at variants being a possible factor in terms of increasing the hospitalizations? Are we testing those patients inside Colorado hospitals for those variants? Do we have any more insight? Is it an age issue? Do we have any more data that tells us what exactly is going on?
Yeah, it's more of a medical question, so I'll go to Dr. Herlihy.
Yes, so we certainly do believe that variants are contributing to increasing hospitalization rates that we are seeing. We know that particularly with the variant that is most common in Colorado right now, which is the B117 or UK variant, that there is some evidence that that variant does cause more severe illness, is more likely to result in hospitalization. And so that is likely playing out here, where we know that probably more than half of our cases in the state right now are due to variants. I think a lot of the work that goes into specifically trying to study the risk factors and the differences in outcomes associated with variants versus other strains are probably best done in epi studies. Not as easy to detangle that in looking at just surveillance data we have in the state, but certainly that work is ongoing at a national level to try and understand some of those differences in risk.
Thank you all for joining us. If you haven't been vaccinated yet, wear a mask, avoid social gatherings with others, and by all means, we're making it easy. Get vaccinated, get protected, return to the lifestyle in the state that we all love. Thank you.
That was Colorado Governor Jared Polis speaking about the latest in the state's battle against COVID-19. The governor starting off with some new stats on today, which were not heading in the right direction. 2,015 positive cases on a Tuesday, a day that, according to the governor, is usually one of our lowest given the low numbers of tests that usually occur over the weekend. That comes out to a 9.64% positivity rate. That's the highest our state has seen, according to the governor, in months. We currently have 622 people hospitalized in our state. Those numbers are increasing, according to the governor. That is among those in their 20s, 30s, and 40s who are unvaccinated, making up now a larger percentage of that group that is hospitalized. The other alarming thing that was brought up today, brought up by the state's chief epidemiologist, Dr. Rachel Herlihy, that case rates are increasing rapidly in children, that the biggest increase was among those ages 11 to 17, that high case rates are in counties with low vaccination rates, something that really makes sense, but we saw it out there on that chart that of those counties that had the lowest vaccination rates, they had the highest number of new cases, and the opposite is true in places like Denver or Boulder that have higher vaccination rates. The lower number of new cases came out of that. The other important piece of information from the governor that now all 6 state-run mass vaccination sites, that includes the Ball Arena, places like Commerce City and Pueblo, are now all of them are accepting walk-ins, no appointment needed for vaccinations. The governor obviously urging people to get vaccinated to try to protect both yourself and other people, making that now an option for people who have held back, not wanting to make appointments online, things like that. He said simply, you don't have to do that anymore. Drive up, walk up. Any of those 6 sites. We have all of those sites listed, and we'll have all of the latest out of today's news conference up shortly on thedenverchannel.com.